Renewal. Presenting today is Joanne Volk from the Center on Health Insurance Reform at Georgetown University Health Policy Institute. Let's welcome Joanne.
Go Hello, ahead, everyone. Thank you. Thank you for taking the time, everyone, to join us and listen to this webinar. I'm sure you've heard that we are now about a week and a half into open enrollment period for coverage in 2015, and you may have also heard that there's a process for people who are in marketplace plans to renew their coverage. We're going to cover today what's involved with that process and what to watch out for. So there are two different pieces going on here with renewal. One is that the Affordable Care Act requires health insurance companies to renew coverage for everyone that's already got a plan to allow them to continue into that plan. The other process going on at the same time is redetermining eligibility for financial assistance if people had premium tax credits with their coverage last year. For the renewal of your marketplace plan, known as Qualified Health Plans, or QHPs, as I said, the Affordable Care Act requires insurers to provide coverage to anyone that applies, regardless of their health status or pre-existing conditions, and then at the end of the plan year to automatically renew it. In the past, insurers used to cancel coverage if they didn't like the claims that were coming in on someone. That's no longer an option. So the insurer must renew the person in the same plan if that plan is available. But if it's not available, the law gives the insurer some flexibility to substitute a similar plan or product based on federal rules that outline how they can make substitutions. So you end up in a plan that's similar to the one you had last year if the one you had last year is no longer available. The consumer does not have to take any action to stay enrolled in the plan. They can be automatically enrolled without doing anything. But here's the thing. We recommend that all consumers should take action to review their plan, and if you must update your eligibility information, make sure you're getting the right premium tax credit. Even if you decide to keep the same plan but update your premium tax credit information, you actually have to reselect the plan. It's a two-step process. You must do both parts to enter 2015 with a plan and a premium tax credit.
So, quick question. Why does the insurer get to put me in a different plan?
Well, it's long been the case that insurers can cancel the plans they're offering. But once they decide to offer a particular plan, they are not obligated to offer it forever. If they decide for whatever reasons, for business reason, to no longer offer that plan, they still have to renew you in some plan. And so the law gives them some flexibility to determine what plan that would be. It does have to follow certain rules to make sure that it is as close to the old plan as possible, but it will be different.
So all the rules that were in existence before still apply now, right?
So I'm sorry, which rules?
The QHP rules.
Yes, all the same rules apply for all the protections in the marketplace plans as existed before. So all the plans have to still meet all those rules, but there may be some differences in how the cost sharing is done or the provider networks. It may be a different plan and still comply with all the rules.
Thank you.
Okay. Now, the marketplace is going to send out notices to all QHP enrollees. There are different types of notices that are outlined in federal rules that the insurers have to follow. So these should all look the same for consumers. If the consumer is going to be auto-renewed in the same product, they can do so in the same product, and there may still be some changes to the plan. They have to make note of what those changes would be. They can renew them in the same plan, but actually in a different metal level is one of the options for insurers. They can also auto-renew the person in a totally new product, a different product line. So, for example, an HMO instead of a PPO, and that may be in the same metal level but have significant changes. So you've gone from a silver PPO to a silver HMO would be the type of change that this notice would address. And then finally, if an insurer is no longer offering a product, any products on the marketplace, then the consumer will have to take action to retain coverage because the insurer is no longer offering a product. Okay. The other process that's going on, as I said, is not just renewing your plan, but renewing your financial assistance if you're someone that qualified for premium tax credits and potentially cost-sharing reductions that reduce the out-of-pocket costs. The marketplace is not going to automatically update your eligibility for premium tax credits and cost-sharing reductions. They're basically going to carry forward the level of assistance you had in 2014 to apply in 2015. Most consumers fall into this bucket where they will get the same tax credit as they had in the previous year if they don't take action. All consumers who authorize the IRS to check their latest tax data, which is more than 98% of the applicants, checked a box that said, go ahead and check my data. The federal marketplace will look at their current FPL, federal poverty level, based on their 2014 income and make a determination about their tax credit. And then depending on this information, the consumer may receive an outreach message or special notice that calls out that they need to pay particular attention because of what the IRS has learned about their tax information. And we'll go through that. To update your information to get a new eligibility determination for your premium tax credits, you can do so either by contacting the marketplace online or calling the call center and updating your financial and household information to get a new determination for your financial assistance. If you don't contact the marketplace and you authorize the IRS to recheck your tax data, as I said, you're going to get the same level of tax credits in 2014 that you had in 2015. And remember that in 2014, that was based on your 2013 income data. So this is starting to be a very old and potentially inaccurate tax credit if you don't go back to the marketplace to update your information. The only exception, the only group that doesn't automatically get renewed in a plan with their tax credit is people that when the IRS does an income tax check, it looks like their latest income would suggest that they're over 500% of poverty, which would make them ineligible for tax credits. And they will get a special notice that says, if you don't come back to the marketplace, we'll continue your plan, but you'll lose your tax credit.
So how do I know what information is already in the system for me, so I know whether or not that there's anything I need to update or change if I didn't allow the IRS to recheck the data?
Right. Well, that's a good question. I mean, who remembers what information they might have entered in 2013 based on what income or other sources of income they had in 2013? The system allows consumers to go in and check what the application looks like, what information is there for them based on when they applied the first time. So they can check that information without confirming it. So you can at least see what information they have on you, and you will know whether or not what you currently are earning is very different from that.